On this episode,
Oh my God.
a tiny stray's mystery injury stuns Scott.
Isn't that just shocking?
So the lump actually is just underneath the skin here.
Has cancer returned in Matt's beloved Cockalier, Sandy?
You're such a good girl, aren't you?
I'm hoping that I don't have to amputate one of her toes.
And will Audrey be able to resolve Tuan's persistent paw problem?
Hopefully, no more open wound, hey?
You make my world a better place.
Come on, there's your girls.
Can't depend on you.
Bondi Vet Hospital. Hi, Matt. Oh no, what's happened? Is Sandy all right?
In Bondi, Kate's just had a concerning phone call from one of her regular patients,
Okay, well try not to worry. I'll see you soon.
and she's booked him in for an emergency consult.
Matt is one of the most vigilant owners that I know, and he has been through the wars with Sandy, and now it looks like she could be facing some serious health issues once again.
Stay. Good girl. Good girl. Good girl.
Sandy is the eldest of Matt's 3 lively Cockaliers.
Good girl. Dogs have always been a part of my life. These 3 dogs have impacted my life more so than any dog as I've grown up. Shake, shake. Good girl. They've been through pretty much everything with me in my life. Good girl. Yeah, good girl. Got Sandy when I was 21, very active dog.
2 years ago, Sandy was diagnosed with a mast cell tumour in her foot.
Yeah, heartbreaking. And, no one wants to hear that their dog's got cancer. We did some further testing to find out that it had actually travelled to the lymph node. It was a bit of a shock. And then we obviously went down the process of getting the lymph nodes removed, getting the mast cell removed, and then starting chemotherapy. Good girl.
Sandy's health battle continued not long after, when the cancer returned, requiring more drastic action.
Come. We had the mast cell between her toes here, and when it reoccurred, we had these toes removed. Come on.
Now Matt has made a heartbreaking discovery.
Unfortunately, we found a lump around her rib area. She needs quarterly checkups post-cancer, being in remission, so I just want to make sure that the lump is nothing but a little benign tumour.
Hi, Matt.
Hello, how are you?
Great, how are you? Hi, Sandy.
Good, thanks.
I'm putting on a really brave face for Matt, but inside I'm really worried this is something serious. Whatever the reason that he's here today, I know that we are both crossing our fingers that it's nothing to worry about. You're such a good girl, aren't you? Such a good girl. Sandy has had a mast cell tumour, so a malignant tumour, taken off a couple of years ago. He has just found a new lump on Sandy, which he is very worried about. So the lump actually is just underneath the skin here, so it's in the subcutaneous space. So she's obviously a dog that's now had repetitive mast cell tumours.
Put her on chemo for 7 months.
Yes.
And then got tested and did all the scans and everything again. It was in remission.
Yes.
And then came back again in July. And so that's when we made the decision to chop the toe. Yeah.
So Matt's quite sensitive when it comes to Sandy. If your dog has had cancer before and survived, you're usually pretty sensitive about when there's a new lump that comes up. After they did the removal of the toe, did she have a CT scan?
Yeah.
Full body.
Yeah.
So what I think we should do today is let's take a fine needle aspirate of this particular little lump. So what we do is we take a little needle and we suck some cells out into that needle. We send them off to the path lab.
Yeah.
The pathologist then has a look at them and see if there's any cancerous cells.
Yeah. Okay.
Just going to get some things, get set up. Good job. 5 minutes.
A bit concerning. Kate wants to do a quick incision into the lump just to make sure that there's no mast cell tumours present or any bad cells present. So fingers crossed it's all good.
Hey. So this is Lucky. Stray kitten that his owner, unfortunately, couldn't come in today because she's got COVID. Her friends dropped the cat off, doesn't know anything about the kitten. Hello, yes. Just to say you've got an injury on your back end somewhere, haven't you?
In the UK, a young kitten has been brought into Scott's Isleworth practice with a mysterious injury.
All right, shall we have a look at you? Hey? Oh, look how pretty you are. Oh my God.
Scott is shocked
Oh my God.
when he discovers the nature of the little stray's injury.
His tail's been ripped off. Isn't that just shocking?
Yeah.
My heart's absolutely broken for this poor little kitten. The injury that this kitten has suffered is absolutely horrific. I haven't got any information as yet, and I'm wondering, has it maybe had an incident with a car, it's run, and the tail's been run over, and the cat's kept going? This was an agonizing, almost tearing of the tail away from this poor cat's body. You can see that we have probably a good couple of centimeters of exposed spinal column. So we're going to have to clean this up.
Before he starts surgery on the kitten,
It makes some calls to clients sometimes, but not usually to say their animal's lost a body part and they didn't know.
Scott is phoning the little kitten's new owner to try to find out more information about the horrendous injury.
Hello.
Oh, hi there, Alice. It's Scott Miller here, the vet from the vet in Old Isleworth.
Hi.
You've got COVID at the moment, haven't you? You all right?
Yeah, I'm fine. Absolutely.
God, you poor thing. Just tell me a little bit more about this little kitten.
Yeah.
Your friend mentioned that the cat had a bit of a sore at the back end. What did you understand that his injuries were?
He got caught underneath a recliner sofa.
Oh, a recliner sofa. Oh, I get it. So when it reclined, his tail was in the gap.
That's probably what it is.
Oh, Alice. Gosh. Oh, you poor things. It sounds horrific.
It was a terrible day.
All right then,
Thank you
Alice.
so much.
All the best. Okay.
Thanks.
Bye.
Bye.
Bye. Oh my God. I feel so much for this family. This cat's had its tail ripped from its body. That process of amputation was not a quick one. This is just a traumatizing situation for all involved.
The little stray will need immediate surgery to clean up the wound and stop any infection from further damaging what's left of the tail.
Tail or no tail, you're an absolute sweetheart.
The lump actually is just underneath the skin here.
Yep.
In Bondi, Kate is investigating a worrying lump that owner Matt has just discovered on his beloved Cockalier, Sandy. The 14-year-old has already had one major battle with cancer, so Kate urgently needs to take a cell sample to find out if the cancer has returned.
Good girl. She's not good with needles, so she's gonna jump around. Good girl. Stay. Stay.
Oh dear, hates needles.
Yeah, you get this.
Guys, this is not going to work. I can tell you this right now.
You tried.
Sandy has a serious needle phobia. She is one scared dog when it comes to needles. So we are going to have to sedate her to be able to do it. Just don't look, Sandy. Sedation does involve a needle. Hey, it's not that bad, babe.
It's okay, don't worry.
All we really need to do is just put in a little tiny IV catheter. Oh, so sleepy, guys. Hopefully she doesn't move. Okay, I'll just hold that. You know, my heart breaks for Matt. All of a sudden, Sandy's got a new lump. It's very scary, and I imagine that he would have a real pit of anxiety in the bottom of his stomach. So what we do is we just put these little cells on this slide.
Kate now has the all-important cell sample from Sandy's lump.
Sandy has been through so much already, and I'm glad that this was so quick. Now we wait, and we cross all of our fingers and our toes, and we hope that this comes back with some good news.
What do you think it's going to be?
I'm hoping it's going to be benign.
The samples will now be sent to a pathologist for testing.
Hi!
What happened?
welcome back. Sand. She's a good girl. Sandy. Sandy.
For Kate and owner Matt, it will now be an agonising wait to find out if Sandy's cancer has returned.
Well, Dad's coming back for you soon. You know, I'm concerned about this lump. She's had multiple malignant lumps. She's had multiple rounds of chemotherapy. Is there cause for concern here? Most certainly.
There you go. Here we go.
Hi, Darren.
Hi, how are you, Maureen?
Well, how is Tuan Tuan in the backpack?
Yeah, in my backpack.
All right, let's get you in and have a look at that paw.
Sure.
In Sydney, Darren is bringing in his beloved 4-year-old Persian cat Tuan Tuan to Audrey, desperate for her help.
How's she been going?
Good. Eating, jumping, energetic, and annoying me when I'm working from home. I have her since she was 1 year old. As long as money can buy health, I will spend it on her, whatever it costs. She's my family. She's not a cat, she's my daughter. So that's the paw?
Ooh. She's licking it?
Yes.
She's licking
so
it.
So that's why I have to put the cone
The
in.
cone, okay.
Yeah.
So she's been living with a cone for 6 months?
Yep.
Darren comes to me with a really long history about Tuan Tuan. What started off as a small ulcer on the bottom of her foot ended up being a big gaping hole. He's done a lot. He's gone to a few vets, had imaging done, had a biopsy done, and there's really no reason why this wound won't heal.
Finally, Darren has come to Audrey, hoping she can find a solution to fix the persistent wound.
It's in such a mobile area, so every time she's walking, it's almost stretching so it can't heal. And I feel like if we don't close it, it's going to be a constant battle to keep it free from infection. I'm really worried in terms of skin closure. When you're looking at a foot or a limb, there's really not much skin to play with at all. And I'm hoping that I don't have to amputate one of her toes in order to get enough skin to close up. You're such a good girl.
Your friend mentioned that the cat had a bit of a sore at the back end. What did you understand that his injuries were?
He got caught underneath a big line sofa.
At his UK practice, Scott can't believe a simple accident at home has left a tiny kitten with a shocking tail injury.
Oh, a recliner sofa. Oh, I get it. So when it reclined, his tail was in the gap.
Probably what this.
Scott decides the brave little stray has endured so much, he needs an appropriate nickname.
So many animals are called Lucky. I think unlucky, eh? Unlucky. Whenever we see a patient that suffered a traumatic tail injury, we always want to check for two things. First of all, that there's something called anal tone, that the bum kind of puckers when you touch it, and that will show that they're not going to be incontinent. And the second thing is that they can still use their back legs and they're nice and strong on them, because sometimes when you pull the tail, it can affect the spinal cord further up the body, and that can have an impact on the hind limbs function. So that's good. He's not going to be constipated alongside having this awful injury.
Finally, some good news for Unlucky. His hind legs and rear end seem to be working normally.
Okay, buddy. Sleepy time now. Good boy. Have a lovely dream and try and forget that nightmare you've been through. So what I'm going to be doing with Unlucky here is I'm just clipping up the tail and seeing what's left. Oh my God. Wow. This section at the end is actually a vertebrae, so that's actually a bit of bone. The spine is made up of a series of vertebrae, as we know, and then the ones in the tail stacked along. This one hasn't pulled off completely, but is folded to the side. It's absolutely horrific. I've never seen anything like this in my whole career. I've seen some pretty severe injuries, but one as a result of a reclining chair, well, this is a first for me. So what I need to do is to trim that back and to be able to cover the skin in the area. So yeah, it's a shame that Unlucky won't have a tail, but he's managed to survive this horrific ordeal. He's lost 2/3 of his tail. Unfortunately, he's going to lose a little bit more now. And accidents happen. And I can relate to that because my cat Ricketts has actually had this procedure done 3 times. When he was very young, he got it stuck in a door, had to take a little bit off. Then got stuck in a window, take a little bit more off. And then he got attacked by another cat, had to take a little bit more off. So pretty much every few years, Ricketts' tail got ever increasingly shorter. Unlucky won't miss his tail because he has lost it at a very early stage of his development. This guy will develop perfectly well without it, so he'll be just fine. That's all done. That looks a lot better, so I can say with complete modesty that I am far better at amputating a cat's tail than a recliner chair. After 24 years, thank goodness for that. Just finished his back end. I just come to the front because I wanted to check his mouth, because my thought would be if my tail was caught in a reclining chair, I would probably try and bite at it thinking it was trying to attack me. And then looking into his little mouth, you can see that he's actually lost both of his bottom baby canines, and there's actually some loose teeth here, so he's definitely given that reclining chair a good old bite.
Scott needs to remove 2 of Unlucky's loose teeth.
Just like when a mountain lion's got their leg caught in a snare, they'll chew at the actual trap, but also the leg themselves. And in this case, this kitten has been chewing and biting at the sofa to try and let this tail go. Yeah, good boy. That's it. Well done. There we go. Oh, good little man. I hope this is the end of his bad luck. He's not had a good run, have you, mate? You need to start looking after yourself. Good boy. Oh, poor little boy. Yes, come on then. Come on then. Sweetheart, good boy. Okay, just leave surgery to the professionals, okay? All right. Good boy.
Let's go.
In Sydney, Audrey and vet nurse Brianna have had a call out to check up on one of their regular patients, Harley. The Cavalier has developed worrying stomach issues.
Right, we'll have to see Harley again. Yes. He's got itchy skin, diarrhea, itchy bottom, bad eyes. So
Again?
gotta check him out. Yeah. Here we are. Hey, you good boy?
Harley's owner Monique is understandably worried about her beloved 5-year-old.
We love Harley. He's such a big part of our family. He's always happy. That tail just never stops wagging. He's just adorable. He's the happiest dog I've ever seen. It's very hard when we watch Harley with a sore stomach. He knows he's not well and he puts himself to bed, and that's just not Harley.
Hello.
Hi.
Harley.
Hi, Harley.
Hi Audrey, hi Brie.
What's been going on?
Look, he's doing well, but he's having a few problems with his stomach. Quite a bit of diarrhea and scooting on his bum, which isn't very nice.
Yeah, so he's had these gut issues on and off, and I know that he gets the diarrhea and the gurgly tummy. Is
Yes.
he eating at all?
Yeah, he's eating quite well, but it's not staying in.
Oh, buddy.
It's coming out the other end. And I have also noticed his skin's a bit dry and flaky.
Isn't it?
Yeah.
All right, well, we better get you in the van, check you out, buddy, hey? You want to come for a little adventure in the van? Okay, we'll see you later, Mum. Bye. We really don't want Harley having gut issues long term. Having diarrhea, having vomiting, that's going to cause gland issues, but also it's going to cause malabsorption. He'll fail to thrive, he may not gain weight, he could get super skinny, so we really need to address it. You ready? All right. I know you're a bit nervous, it's okay. Let's have a listen to you, your tummy, your gurgles. Oh, that's uneven sculpture in there, lots of movement.
Oh, buddy, what is happening?
Oh, not happy in there at all.
Hey, Matt. Okay, you're sitting down.
In Bondi, Kate is about to give Cockalier owner Matt the all-important pathology results for his beloved cancer survivor, Sandy.
I've got some really good news for you. It's a lipoma, it's just a fatty lump, nothing to worry about. Everyone, don't worry.
That's fantastic news. But Marley seems to have a similar lump as well.
Oh no, Marley's got a lump now. You're gonna have to bring her in.
I noticed Marley was licking the bottom of her paw quite aggressively. It was quite red, and naturally, obviously, same instance with Sandy, and it was a mast cell, so it was a bit concerning. I wanted to get her down to see Kate quickly to make sure it was nothing. Good girl.
Hi Marley. Hello, how are you?
How are you?
Marley, nice collar. Hello, sweetheart. You ready? Come on, Miles. Poor Matt is really in the wars. First, another cancer scare for Sandy, and luckily that one has come back benign. But now, one of his other dogs has developed a lump. Hello, sweetheart. Can I have a look at you? Hello, darling. I know. I got you. I really want to get onto this one for him straight away. So let's check every little nook and cranny, figure out what is actually going on here. A mast cell tumour is spread very quickly. They're very angry little tumours and we really don't like them. So in between this paw, the whole thing is red. Poor Marley.
It's in such a mobile area, so every time she's walking, it's almost stretching, so it can't heal. And I feel like if we don't close it, it's going to be a constant battle to keep it free from infection.
In Sydney, Darren has brought his Persian cat Tuan in to see Audrey, hoping she can fix a nasty and persistent wound under the 4-year-old's foot.
So do you know what caused the initial injury there? Did it look like a bite or a...
I think she just licked it.
She just licked it and then it's just
Yeah,
got to
because
this
I
point.
did the X-ray, I did the ultrasound, I tried everything, but there's no foreign body inside.
I'll give it a really good clean and then we'll figure out a flap closure. Hopefully, no more open wound, hey?
No more chronic wounds.
Yeah, she is a sweetheart. Tuan's a pretty chilled girl. She's actually one of the best cat patients I've seen in a long time. So I want to get in there, close this thing down so that Darren and Tuan can continue a normal life. I'll give you a call as soon as she's up and recovering.
Sure.
Go from there. Want to say bye to Dad? And we're going to go to a little journey out the back.
Yes.
All right, Darren, I'll be in touch soon.
Darren has put his faith in Audrey after learning about her desperate fight to save wildlife during recent bushfires.
He's actually come as a referral from one of my own vets at Aussie Mobile Vet, Dr Rainbow, and she's been really worried that we'll have to amputate a toe in order to close it down. Hi Rainbow, look who I've got. Being involved in the Australian bushfires and dealing with a lot of burns, especially on feet and toes and kangaroos, I've learnt a few surgical techniques that we can do to hopefully close down wounds so that they heal quickly. She's such a good girl. Chill. Oh, look at the face.
Audrey and fellow vet Rainbow are hoping they can work out a surgical solution for the fluffy 4-year-old.
If you want to have a look at her paw, so it's between this digit and this digit. It's a tricky area. I think it's going to be a 2-person job. Okay, we're going to fix your foot. Her tongue. It's just sticking out. So we draw up some sketches of Tuan's paw and we come up with a few ideas. What do you think about a rotational flap like that? Rotate it in to cover this part and then we can grab some of the skin at the top of the foot and close down.
Yeah.
The plan is to stitch together the edges of the open wound without having to amputate any of Tuan's toes.
You ready? Such a delicate area. It's not just the toes, it's in between the toes. All right, you ready? Go to sleep? So I've got all hands on deck today for surgery. I've got Bree, my nurse, prepping and monitoring the anaesthetic, and I've got Dr Rainbow scrubbed in with me to help me hold the paw, because doing surgery on a paw and keeping the toes nice and straight, it really is a 2-person job.
I can touch the blue, right?
Yep, blue sterile. I start off by really examining the wound. There's a few areas where there's dead skin, so I go ahead and I remove some of that. I'm going to suture the clean edges with lots of fresh blood. So this is probably one of the smallest paws I've done, but we have done younger than this.
The biggest challenge during the surgery will be finding enough skin on Tuan's tiny foot.
Hopefully we don't have to remove a toe or sacrifice a toe so we can use that skin to close up. Listen to your tummy. Oh, that's sounding a bit squelchy in there. Lots of movement. Oh, not happy in there at all.
In Sydney, Audrey and vet nurse Brianna are trying to find out why Harley has suddenly developed stomach issues and diarrhea.
All right, let me just have a look at your gum colour. Okay, the good thing with him is he's still eating and drinking, so we're caught it early, but it's just not sounding good in there. Yeah, I feel. It's becoming a bit of a problem. It's all right, Harley. It's okay. All right, so we're not happy in there. We know you're having the runs. Next step, I think we have to check your bottom out. It's not your favourite part, but from history, every time he gets a diarrhea, his anal glands block up.
I know, it's okay. It's okay.
Sorry, baby. Or they are full. So on top of having a really bad tummy, he also has anal gland issues. And these are basically two little glands that sit on the outside and they become blocked if they're having diarrhea or soft stools. I know, almost done, almost done. You know this one takes a long time. When the anal glands become blocked, it becomes very uncomfortable. They're quite sore, they might scoot, it's really, really itchy. Okay, well, the skin, the diarrhea, the bottom, I think we need to look at a long-term solution with diet. All right, buddy?
See if we can make your tummy all better.
All right, let's get you back to mum. I have a solution for Harley today. It's diet-based. He's got a bag of problems from allergy to dietary intolerance.
I know, you're very eager to go back to mum.
So I really want to address the food he's taking in. All right, Mum, he was a very good boy.
Oh, that's good. How are his glands?
So his glands, as expected, were a little bit full, and that's because he's been having softer stools, so they block up really easily. I am quite concerned with his gut. It does sound very squelchy. He's a little bit sore when we go to feel him, but lucky for us, it's pretty early. He's still eating, he's still drinking, but long term, I think we need to look at his diet and try and prevent this from happening.
Yep.
So brought along one of my favorite products. It's basically chicken and brown rice. Single protein, we know he's okay with chicken, and it's going to really help his dietary intolerance and hopefully no more diarrhea or bum issues. So we'll try him out on this diet for a couple of weeks and then I'll touch base with you and see how he's going. But hopefully he's going to resolve his gastrointestinal issues. So we'll give it a go, see if he likes it. I have a sneaky suspicion he's going to like it because he's checking it out already.
Have a look at that.
Ooh, you want to try?
He wants that.
Smells good. It's chicken. Oh, I think he likes it.
He likes it.
Good. You like that? I can tell.
Because we're putting Harley on a single protein trial, this is going to be the only food he's going to eat. It's complete and it's balanced. Well, that's really good, Monique. I think I'm really happy that he likes it. I'm going to leave you two with that for the next couple of weeks, and then we'll check in again on his tummy and his skin and see how he goes.
Sounds good.
All right. Sound like a plan? Sound like a good plan. All right, we'll see you soon.
Bye.
Be good for Mama.
I'm very excited to try the new food on Harley and to finally resolve his stomach issues and to get him back to being the happy dog he should be.
Do you like that new food? Will we give it a try? I think so. Yes? Okay. Good boy.
It's a good boy.
At Scott's Isleworth practice, Unlucky's shocking tail injury has been successfully repaired.
Hi there, Alice. It's Scott here.
Hi.
And Scott is keen to pass on the news to his worried owner, Alice.
The surgery's gone very well. So he's lost about 2/3 of the length of the tail, but he's young and I think that he'll get over it very, very quickly. So I really don't think that you should worry.
Okay.
Okay. See you later. Speak soon. Unlucky's owner said what a beautiful, fluffy tail that this little kitten had. And yes, he's been quite unlucky, but he got away with this traumatic injury. So I'd hope that even though he has a short tail, he will have a very long and healthy future ahead of him.
So in between this paw, the whole thing is red.
Yeah.
Red, red,
That's
red.
what she's been licking.
In Bondi, Kate is trying to find out if 4-year-old Marley could have cancer in one of her feet.
Okay, so now we have to figure out why it's red.
Owner Matt is extremely concerned. The oldest of his 3 Cockaliers, Sandy, had a similar problem, which led to cancer and her toe being amputated.
So the whole foot is red.
Of course, Matt is quite sensitive when it comes to tumours, especially on feet. So as soon as he sees Marley chewing vigorously at that foot, he's like, whoa, what is going on here?
There's absolutely nothing stuck in these feet.
She's probably been bitten by something, and then what's happened is she's licked it and then she's given herself a skin infection, right? So I don't think this is a mast cell tumour.
That's good then.
Yeah, so there's no discrete masses there, right? So happy days.
So I can sleep now?
You can sleep now.
Great. Big relief that it's not a mast cell tumour. We've still got to deal with the fact that she's got an infection, but you know, I prefer infection any day to cancer, so very happy.
There you go, Babs.
Good girl.
Kate gives Marley anti-inflammatory medication and puts her on a course of antibiotics, which should clear up the infection in a few days.
Awesome. See you later.
Bye, Marley. What I think is going to happen in this case is Marley's going to go home, she's going to take her pills, she's had her anti-inflammatory injection, and I reckon that this foot is going to be fixed.
Come on. Come on, baby. Let's go.
But just a few hours later, Matt is back for a 3rd visit to the Bondi Vet Hospital. This time with his youngest Cockalier.
This is Zoe. She's just over 12 months old. She's having a few little issues. A bit of bleeding. A bit concerning, so I'm just hoping it's nothing serious.
So this is probably one of the smallest paws I've done, but we have done younger than this.
In Sydney, Audrey and fellow vet Rainbow are desperately hoping they've found enough skin to repair a nasty wound under Persian cat Tuan Tuan's paw.
It's a bit of a trick to find enough skin to close it, and also to close it without any tension, because it's a foot, so she's going to be putting a lot of weight on it. Hopefully we don't have to remove a toe, so this one's going to be a bit tricky, Rainbow. I'll try and get the right angle. You can pull it towards you, Rainbow. A bit more.
A bit more?
Yep, a bit more. And bring it across, and then pull the skin from here to close. I was thinking we had to take off that toe and use the skin to close, which obviously last resort.
It's interesting to see the method. In my first thought, I was thinking we need amputation. Didn't think about this method.
Okay. So I'm pretty happy it's closed, and then also we haven't made it tighter in any way so she can still spread her toes. I'm really pleased with how it's looking. There's a lot of stretch there. So it's good news for everyone because Tuan Tuan gets to keep her toes. All right. We're gonna laser it, which is one of Rainbow's favorite treatments. And what laser does is bring blood and healing factors to the area so that we know that the surgical wound is gonna heal nice. Yeah. Does your tongue ever go back in? Yeah.
With surgery successfully completed,
Okay.
it's time to reunite Tuan Tuan with her loving but anxious owner, Darren.
Yes, she is. She's a girl. She is an absolute angel. Honestly, one of the best cat patients. Take her out, give Daddy a cuddle. So I'm really positive with everything. I think it's going to heal well as long as we protect it. No reason why it shouldn't. You want to go back in there?
Yeah, somewhere to save.
Yeah. So if you want to make sure, especially once the bandage comes off, that you stick a collar on.
Yeah, of course.
So you keep doing what you're doing, which is a good job. Okay.
I'm so happy because we tried many other things before. She's still alive. She's still good. So I'm already super happy already. Thank you.
We'll see you soon. All right, Tuan Tuan, bye.
Bye.
See ya. I can just see the big sense of relief on his face. Hoping that this is the end of this 6-month-long journey of this open wound at the bottom of her foot. So I'm hopeful that they're going to have a happy life, full of toes and no wounds.
girl.
At the Bondi Vet Hospital, Cockalier owner Matt is making yet another visit to Kate.
Matt, you're back.
Back.
What is going on? I mean, don't get me wrong, I love seeing my regulars with their pets, but Matt with Sandy, then Matt back with Marley, and now can you believe it, Matt back with Zoe. Hey Zoe, how are you? Would you like to go first?
Come on,
Go
let's
on. Matt seems to be having a few troubles with his dogs lately. Matt, did you change socks?
I changed clothes.
Matt is a happier Matt this visit. So fingers crossed with Zoe that we're not going to have to talk about lumps or cancer or anything too serious.
Yep.
Zoe has a slightly different problem to what Marley had.
Yeah, Zoe's got bleeding around her vagina.
Bleeding?
Yeah,
Inside?
because she's desexed, so there's no reason why it should be, but on the outside, so it's like she might have a cut or something, I don't know.
Okay.
Ever since the oldest of his 3 dogs had a long battle with cancer, Matt is wary about any other health issues with his fur family.
Beautiful, beautiful. Moment of truth. Let's have a look back here. She does have quite a lot of dermatitis under here. So this is what we call a perivulvar dermatitis. When you've got heaps of folds in an area, it's really prone to getting infected. This is very abnormal.
Abnormal?
Yes, she shouldn't have this. You can see how the skin is affected around here.
There's nothing sinister given that it's external?
That's right.
Okay, so we just got to work out why it's happening.
She's a little bit fat. She has a lot of rolls around the vulva and it's very tucked up, which means that particularly when it's really wet and humid, it's a good recipe for getting perivulvar dermatitis. You're very cute and a very good girl.
But Kate wants to rule out a urinary tract infection.
Come on, let's go. Come on.
And for that, she needs a urine sample.
Let's go, guys. To the park, to the park. Go to the toilet. Oh. Got it, thank you.
Really?
Yep. Everyone knows that I'm the best at catching urine. If I can't get urine, no one can get urine. Nothing.
Yeah, nothing interesting.
Nothing and nothing. It's great. Zoe's urine is absolutely perfect. She's got no white blood cells, she's got no red blood cells, no ketones, no glucose.
I heard they're good.
Yeah, did you know already? Yay. So we are just dealing with a straight perivulvar dermatitis here.
Beautiful.
Nothing sinister going on with Zoe, and that's exactly the news that Matt needed to hear from me. As much as I love visits from these 3, Marley, Sandy, Zoe, let's hope I don't have to see them for quite a while. Bye, Zoe.
Thanks, mate. Cheers. Come on.
See little Harley boy.
In Sydney, it's been 2 weeks since Audrey and Brianna last visited Harley, who had some worrying stomach problems.
Okay. I heard it's his birthday today.
It's his birthday today.
All right.
They're hoping a change of diet has helped improve the young Cavalier's condition.
What do we do?
Hello, Harley.
Oh,
hi, Monique. Hi, baby.
Hi.
How's he been?
He's going really well. His stomach issues are so much better. So the diarrhea has absolutely disappeared. He doesn't have a gurgly tummy anymore. And his skin's even looking better too. He's back to his original self.
Amazing. That's what we want. I mean, it's only 2 weeks into the diet and he's still got another 6 to 8 weeks, but I think he loves the food. It's going great. It's all uphill from now. And I did hear it was his birthday.
Yes, he's 6
Harley,
today.
you're 6 today, and because you can't have any other food, so we couldn't bring you a birthday cake, we bought you a toy cake. What's that?
Is it your birthday?
Oh, he likes that.
Happy birthday from Auntie Brie and Auntie Audrey. You're a good boy. I'm really happy with Harley today. He's happy, he's healthy, he's going to the toilet normally, and his skin is also looking good. So I'll check in again in about 6 to 7 weeks, and he's on the right track.
Bye, Harley.
It's wonderful. There's nothing worse than seeing your dog upset and sad and in pain. And the food has worked so well. He's back to his happy self and we couldn't be happier.
That's my boy. Yes, so beautiful. Beautiful.
It's been 3 weeks since Kate treated all 3 Cockaliers owned by devoted pet owner Matt. And it's great news with all his beloved dogs given a clean bill of health. 2 weeks after Audrey repaired a nasty wound on Tuan Tuan's paw, the young Persian is back to her playful self.
What are you looking?
And her foot is fully healed.
Hi, I'm Dr Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.